watching Managing Arthritis by Dr. Alyssa Gall on Resonance Wellness TV, part of our Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events at whole-life-medicine.com.
Good evening, everyone, and welcome to this presentation on managing arthritis. My name is Dr. Gall, and I will be your guide on this webinar where we're going to explore arthritic conditions. Our lecture on arthritis today comes under Alleviate from the Whole Life Medicine model, which is the first step in health strategy at Resonance Wellness. Alleviate is my first step in my approach to patient guidance. And in short, there are three considerations when we're looking at strategies to resolve a health issue in Alleviate. The first is to consider what the root causes are in our health situation and to ask ourselves, what's the setup? And in tonight's presentation, we're going to talk about this in some detail with respect to arthritis. All chronic disease has a root cause. The second is to look at the state of the tissues involved. In the clean slate process, we look at how to improve the cleaning up of the tissues that get bogged down in disease processes. And lastly, we'll take a look at missing ingredients affecting metabolic and repair of the tissues in your body and take a look at how that affects your joints. So with those in mind, there's problem-specific programs for specific arthritic conditions, and those can be created really by co-creating a newer, healthier state, taking into consideration what your disease process is. Now, of course, we're not going to be able to talk about the interventions for every type of arthritis, but we are going to look at some of the root cause issues, some cleaning up, and some potential missing ingredients today. So with those thoughts, we will dive in. So first of all, we have to clarify what arthritis actually is. So arthritis is not a single disease, but it is an informal term that refers to various conditions of joint pain or joint diseases. There are actually over 100 different types of arthritis and related conditions, but the most common types would be osteoarthritis, which most people have heard of, rheumatoid arthritis, psoriatic arthritis, fibromyalgia, it's considered a type of arthritis, gout, and lupus. And like I said, there's at least 95 others that we could discuss. We just don't have time for that tonight. Arthritis affects people of all ages, genders, and races, and it's a leading cause of disability in Canada. In 2008, 15% of Canadians aged 12 or older reported a diagnosis of arthritis. So that's about 4.5 million people. Generally speaking, it's about 12% of that is males and 18.5% of females report it. So in every age group except for the youngest, which is 12 to 24, females are way more likely than males to have arthritis. The differences were large at older ages. So among people aged 65 or older, females were 50% more likely than males to report a diagnosis of arthritis. As in other countries, arthritis in Canada really does become increasingly prevalent with advanced age, and approximately 1 in 3 senior males and 1 in 2 senior females are reporting arthritis as of 2008. That's the last large public health study for Canada. And although arthritis is associated with aging, a substantial number of Canadians in their prime working years will report this condition. At ages 45 to 64, for example, 17.2% of males and 24.8% of females are reporting this. So it's estimated it costs about $17 billion to deal with this in Canada. So let's take a look at some of the common types of arthritis now that we can see how incredibly common it is in general. So the first one we're going to talk about here is osteoarthritis. So osteoarthritis, which is also called degenerative or wear and tear arthritis, is the most common form of arthritis. And wear and tear definitely contributes to osteoarthritis. However, it's really likely that the mechanism of this disease is starting with inflammation systemically, and along with trigger events, it starts a damaging process that the normal healing mechanisms may have difficulty repairing in the cartilage of a joint. Cartilage is a firm, slippery tissue that supports the smooth joint motion. And osteoarthritis occurs when protective cartilage on the edge of bones wears down over time, leaving bone rubbing on bone. So osteoarthritis can damage any joint in the body. However, joints in the hands, knees, hips, and spine are more frequently affected. So common symptoms which develop over a long period of time are pain in the joint during movement, joint tenderness when pressure is applied, stiffness following periods of inactivity, like when you first get up or if you've sat down for a little while. And there can also be bone spurs forming around the affected joint. The most common risk factors for osteoarthritis are, again, age, similar to all forms of arthritis, and women more likely to develop it than men. Carrying extra body weight actually will increase your risk of osteoarthritis because the extra weight stresses the joints. Sports injuries can be a precipitating factor, and then certain occupations where there's repetitive stressors on a joint. So this is a little bit more common in people who are doing things like repetitive keyboard work or piecework at a machine. So we're just going to take a look using the example of osteoarthritis as a starting point to show what arthritis is really affecting. Here we're seeing a healthy knee joint from the side. So what you can see are the bones of the leg coming together, so the femur end on the top and the tibial end on the bottom. And then you can see in pale blue the cartilage surfaces on each end of the bone. You can then see a space around the bony joint that's lined on the outside with red. So this is the synovial membrane. So the synovial membrane, or synovium, secretes like a lubricating fluid that's secreted into the joint cavity space. So you can see pink layers of muscle and tissue that go over the joint in the front and the back. And part of the stability, of course, of the knee joint is how many layers of muscle and fascia you've got connecting over those spaces. So then let's take a look at a pretty healthy joint. So on the right, you're going to see a pretty healthy shoulder joint. So this is with the arm at the side of the body. So the shallow space for the head of the humerus is kind of at left in this particular photograph. And you can see how smooth the cartilage surface actually looks with pretty good thickness. And another diagram of a normal joint is shown at left. This is kind of more of a idealized, spaced out version, so you can see a little bit more markedly the spaces. But even on the cadaver section on the right, you can see that there's a good amount of space there, and the cartilage looks nice and healthy. But then when we get to the point where things are a bit diseased, we go from that look that we have here on the left to the middle look. So this is an example of osteoarthritis, and what you can see here is that there's a lot of bone spurring towards the edges of the joint. There's a loss of the blue cartilaginous surfaces, so they're colored in blue here. And you can see that the synovium is thickened and inflamed. So you can also see on this slide rheumatoid arthritis, which we're going to talk about that in just a second. And the difference here is you see a lot more synovial inflammation to the point where the actual joint is being eaten away by the inflammation. And you'll also see that there's almost the complete loss of the cartilaginous spaces in between the two bones and partial fusion on either side. So this is where you start to get it where a joint is actually not very functional at all. So what you can't see really in these diagrams is the ligaments that are holding the bone ends together. They're also being damaged in this process. It's just not really clear on this diagram. But regardless, you're seeing like kind of two different kinds of swelling here around the joint, one which is very bony and one which is very inflammatory in nature. Two different types of arthritis. This is actually a histology picture, and that means that it's a microscopic picture of the cartilage in this example up close. So on the left-hand side, you can see the normal articular cartilage. So this is the layer of cartilage that's coating the end of the bone. And what you'll see is to the left, we're seeing, like I said, a healthy version. On the right, what you're seeing is an osteoarthritic cartilage. And there's a couple of major features here that you're going to see. So on the right, the abnormal cartilages, the cells that make and maintain the cartilage have started to change, and the cartilage surface is starting to roughen on the upper surface, while the attachment at the bone end is starting to look abnormal. You're seeing what's called subchondral bone plate thickening and what's called vascular invasion. So you're actually going to get more red, you're actually going to get more blood leakage there. And blood leakage into tissues is actually quite painful anywhere it happens, and also brings a lot more inflammatory damage. So it's a kind of the beginning of the process here. Obviously, this cartilage hasn't worn away, but it's starting to show you the features of what starts to happen when it's not normal. So let's take a look then at rheumatoid arthritis. We're going to kind of circle back to what we were just talking about. So rheumatoid arthritis is an autoimmune disorder where the immune system is damaging the healthy body tissues and causing chronic inflammation. So this form of arthritis affects more than joints. It can also damage other systems of the body, such as the skin or eyes, lung, heart, blood vessels. So like we saw in the diagram, bone erosion and joint deformity are caused by the really painful swelling of the joint linings, the synovium, and it's not really associated with wear and tear damage of osteoarthritis, not in the same way anyways. I mean, certainly if you have rheumatoid arthritis and then you're also doing things repetitively, it's not going to be helpful, but it isn't part of the major cause. The actual cause of rheumatoid arthritis specifically is still unknown. But genetics is really thought to play a part. Although genes don't really cause a disease, genes can make you more susceptible to environmental factors, such as an infection with certain viruses or bacteria that can really trigger the disease. And the disease typically starts in smaller joints, so the fingers and toes, and then it kind of progresses to the wrist or the knee, ankle, elbows, hips, and shoulders. Whereas, like with osteoarthritis, it's typically in high wear areas for whoever that person is. Symptoms also in rheumatoid arthritis generally occur in the same joints on both sides of the body, and it'll include a tender, warm, and swollen joint. And a joint stiffness that's usually worse in the mornings and after inactivity, fatigue, fever, weight loss. These are all kind of things that happen as a consequence of the immunological issues in rheumatoid arthritis. There's also a tendency to see more women developing the condition than men, and it can occur at any age, but most commonly between ages 40 to 60. Family history can increase the risk. Smoking definitely increases the risk and the disease severity. Environmental exposures such as asbestos or silica may actually increase the risk, and obesity increases the risk. So some of those things obviously also in common with osteoarthritis, but it's quite a bit of a different mechanism. As you could see on the diagram, it's substantially different in terms of what ends up happening to the joint. Now, there's also something known as psoriatic arthritis, and what that is also an autoimmune disorder, also an autoimmune inflammation that affects some people who have psoriasis. So we see here a picture of a pretty standard plaque of arthritis. You may have seen this in yourself or in other people, and it's a plaque of skin where there's overproduction of skin cells. So you're basically dividing those cells much, much more quickly, and they start to build up and create this flaky plaque-like thing in the skin. And then it's not really well-made skin, so there's a lot of flaking and damage. So there's genetic and environmental factors that really play a role in the development of this condition. There actually are certain genetic markers that are identified which are associated with psoriatic arthritis. And a viral or bacterial infection may easily trigger psoriatic arthritis in people with the inherited tendency. So symptoms can worsen over time with alternating periods when symptoms go into remission or they worsen. And the symptoms for psoriatic arthritis resemble rheumatoid arthritis, but they can affect both sides or just one side of the body. Psoriatic arthritis is much more likely to cause swollen fingers and swollen toes. Foot pain is very classic. Lower back pain, and the common risk factor are having psoriasis, having a family history of psoriasis or psoriatic arthritis, and age. It actually typically occurs between the ages of 30 and 50. Now, another major category in arthritis is under the category of fibromyalgia. And fibromyalgia is actually kind of like categorized under a central pain syndrome. So that means that the brain and the spinal cord process pain signals differently instead of normally. But it's still included in the arthritis category because the chief symptoms are very arthritic-like. So researchers do propose that fibromyalgia is really a magnification of pain sensations by affecting this way that the brain is processing pain signals. So other symptoms common amongst fibromyalgia include tension headaches, TMJ disorders, so that's the jaw joint, the temporomandibular joint, irritable bowel syndrome, and anxiety and depression. So symptoms can gradually accumulate, or they can have a triggering event, like a physical trauma or a surgery or an infection or very significant stress, psychological or otherwise. And the symptoms here include things more like widespread pain, like a constant ache that lasts for months at a time on both sides of the body and are both below and above the waist. Fatigue is a major problem. Feeling tired even after a long sleep period. Cognitive difficulties that impair the ability to focus or pay attention to mental tasks. And then keep in mind that this is affecting more women than men. There's a higher risk when there's a family history, and other disorders such as the osteoarthritis, the wear and tear arthritis, or rheumatoid arthritis, or lupus can actually increase the risk quite a bit. So again, we're not going to be able to go into huge detail about it, but I just want to kind of give you an overview. Another common form of arthritis, but no less complex, is gout. It doesn't actually cause body-wide inflammation. It's characterized by sudden, severe attacks of pain with swelling and redness and tenderness in a joint. And it's most often a joint at the base of the big toe. So like right under the ball of your foot, or the one that's like literally one up from that, or a combination. And what gout is, it's the result of an accumulation of uric acid crystals. So the body is producing too much uric acid and it can't remove the excess fast enough. And so it actually literally crystallizes. So uric acid is a product from the breakdown of purines. So purines are a kind of nutritional material which are found in foods such as steak, organ meat, seafood, and alcohol. So uric acid normally just dissolves in your blood and it goes out your kidneys and is excreted in your urine, hence the term uric. But if that process is disrupted, uric acid can really build up and it forms sharp needle-like crystals in the joint or in the surrounding tissue. And as you can imagine, that causes a fair amount of pain and inflammation and swelling. So symptoms occur suddenly, often at night, and they include an intense joint pain, usually in the big toe, ankles, knees, elbows, wrists, and fingers. The pain is the most severe within the first 12 hours. However, discomfort can last for up to weeks later. There's inflammation or redness in the affected joints, a limited range of motion. And then common risk factors, it occurs much more frequently in men or postmenopausal women. A diet that's really rich in meat and seafood and drinking a lot of alcohol or beverages sweetened with fruit sugar will increase the risk. Obesity definitely increases the risk. Any untreated high blood pressure, a chronic condition like diabetes or metabolic syndrome, and heart and kidney diseases will increase the risk of gout. And obviously a family history, so there's probably some amount of genetic background to it. Next, just to describe another major condition that many people have heard of, and perhaps some of you are struggling with this one, is lupus. And lupus is another form of autoimmune disease where we can see joint pains. It's another systemic autoimmune disease where there's a lot of inflammation, and it can affect more than just joints too. It can affect the skin or the kidney, blood cells, the brain, the heart, and the lungs. Lupus most likely develops for a combination of genetic and environmental factors, but the cause in most cases is unknown. However, known triggers include sunlight, stress, and smoking. So there's high correlation to that. Infections like Epstein-Barr virus, which is actually a fairly common virus. And usually when you're seeing infections with that, what you're really showing already to a degree is some of the immunological weakness. Lupus can also be induced by certain medications. And hormones might also play a role because it's most common in women of childbearing years. So studies show that increased lupus risk is associated with long-term exposure to pesticides. And it can really mimic a lot of other ailments. It's quite difficult to diagnose, especially when it's in the beginning stages or more mild. And no two cases are really exactly alike. So that said, the most common signs for lupus are things like fatigue, fever, the joint pain with stiffness and swelling, a butterfly-shaped rash on the face that covers the cheeks and the bridge of the nose, or sometimes rashes elsewhere on the body, skin lesions that appear with sun exposure. So there's a kind of a variety of photosensitivity that happens with lupus. The fingers and toes can turn white or blue when exposed to cold or during stressful periods. So basically it's like a Raynaud's phenomenon. It's quite associated with lupus. Also to a degree with rheumatoid arthritis, but for sure with lupus. Shortness of breath, chest pains, dry eyes, headaches, confusion, memory loss. And risk factor wise, it's much more common in women between the ages of 15 and 45. And it's actually much more common in African Americans or Hispanics or Asian people. I don't think anybody knows exactly why. So when we're looking at helping arthritis symptoms, there are some very basic things that you can do to help with joint pains in general. One, of course, we've already touched on. You can lose some weight. It really does decrease stress on the joints, and it also decreases inflammation quite a bit. And don't ignore injuries or try to just push a joint that's hurting. You know, that really doesn't help. This is kind of like an old school way of handling injuries and pains. And really what we're starting to really see is that pushing through and running on a damaged joint, as an example, is just not a good idea. You're just improving the systemic inflammatory status, and that doesn't actually help heal a joint. And don't overuse an already damaged joint. I mean, gentle mobilization and stretching the tissues around a joint is a much better idea. So keeping it mobilized and moving, but not pushing it really, really hard. Now, you just can't appreciate the amount of the time that joint pains are worsened substantially with hydration problems. You know, and I know that I repetitively talk about this, but that doesn't mean it's not true. It actually can have a big impact on the way that your joints feel. And if you're not well hydrated, you just don't do a great job of clearing stuff out of that cartilaginous space, just like you don't do a great job of cleaning other things out of other compartments. So it's not really rocket science. I've had lots of people with osteoarthritis where a lot of the like the baseline of the osteoarthritis is just having such a poor hydration state. And if you don't know what I'm talking about or how to accomplish that, you can go to the whole-life-medicine.com site, and under essential handouts is the water and salt handout, and there it talks a lot more about this in detail, but it's super important. And sometimes, especially in beginning stages of osteo, you can have a huge impact on the pain levels and not Inflammation a little bit, but it's not direct. It's actually just because you're creating better circulation through a joint. Now, there's also kind of a central tenet, and here, this is why I'm putting it down as a part of the root cause review, is that it's really important to understand that there's a link between gut health and arthritis. And most studies examining the role of gut health and joint pain is really centering around autoimmune diseases like the rheumatoid conditions or psoriatic arthritis and lupus. It can still have a big bearing on osteo as well, but conventional treatment obviously is relying a lot on pain relievers. So steroids or non-steroidal anti-inflammatories like NSAIDs. And there's a real need for pain control that those drugs obviously can meet, but they do disrupt the gut microbiome even further. There's actually a plethora of scientific literature that's connecting gut health and joint pain, and it's really revealing a strong association between altered intestinal microbiomes and the various arthritis types. And some studies have even found that depleted levels of a kind of species of bacteria called Haemophilus and an overabundance of certain types of lactobacillus can be involved. And inflammation can be aggravated by the overgrowth of these pathogenic bacteria or a lack of immune modulating commensal bacteria. So you need to have a balance in your microbiome to keep you defended. Other studies report finding high levels of other types of bacteria and then low levels of bifidobacterium. At the end of the day, it basically is just showing us that we need balance that is specific to each of us in the microbiome. So let's talk a little bit more maybe about the microbiome. So a microbiome is literally the dynamic collection of microbes in an ecosystem, and in this instance, the guts. So the human body hosts a variety of different ecosystems called microbiomes, and the gut microbiome refers to bacteria living along the entire digestive tract, which ranges from the mouth to the anus, most of which are located in the small intestine. And gut bacteria serve a variety of purposes. They aid the immune system. They break down nutrients for absorption. They regulate the chemicals that communicate with the brain that affect memory, mood, and sleep. They regulate hormones to keep the body properly balanced. And there's really probably about 400 species of bacteria in your system that make up your gut microbiome. And so if you have a lack of bacterial diversity, historically we've called that dysbiosis, and it is strongly associated with various forms of arthritis and other immune diseases. We talked about this a little bit in our previous lecture last month about autoimmune thyroiditis, so you can kind of refer back to that. And while every person has a really unique gut microbiome, the general population does share some commonalities. In fact, across nations, populations show varying gut microbiomes. For example, people living in Canada are going to be notably different than the gut microbiomes of people living in China. And a lot of that has to do with what kind of bacteria are crucial in your digestive process. What are you digesting? Who's your mom? Because you actually get your microbiome from your family. In fact, the microbiome can be specific enough that you can identify members of the same family from a microbiome. And a newborn is inheriting the microbiome from their mother at birth. So when the bad bacteria outnumber the good ones, again, you get this dysbiosis situation. And dysbiosis can occur at any stage of life. It can occur suddenly. Sometimes it'll happen as a consequence of food poisoning, as an example, or over time. It can just develop slowly. So sudden imbalances are usually the result of an infection, or a lot of the time it'll be the use of an antibiotics for something else other than the gut. So if you get some antibiotics for sinusitis, as an example, or for pneumonia. And diet, medications, alcohol use, smoking, those are the kinds of things that can create an imbalance that's more long-term, that develops over time. So testing for this isn't standard practice conventionally, but at Resonance, testing of gut bacteria can be an important step in arthritis management and in a lot of inflammatory conditions. So common symptoms of gut biosis, so this is kind of over and above what you would expect with joint pain, is to have things like frequent gas, bloating, and belching, loose stools, diarrhea, constipation, an unexplained weight gain or difficult weight loss, IBS, IBD, which is irritable bowel disease. So that's where you actually have a pathology in the gut. Anxiety, depression, or frequent low mood can sometimes be caused by problems in the gut flora. Brain fog, obviously the joint pains, skin conditions like acne or eczema, low energy, a diagnosis of some other autoimmune condition like we talked about before, Hashimoto's thyroiditis, allergies, food sensitivities, and chronic yeast or fungal infections. So when we look at that, obviously to heal the gut, it's necessary to regain the proper bacterial balance, and beneficial bacteria need to be restored while problematic bacteria need to be reduced. So when we're doing that, we've got to obviously improve the diet and reduce chronic stress. Those are key factors. So stress can cause inflammation of the whole gastrointestinal system and make you more susceptible to infection. It's important to find ways of reducing stress when you're trying to heal your guts. So mind-body practices and exercise are also beneficial for stress and gut healing. And the keys are to find activities that you enjoy, obviously. So dance, yoga, meditation, breathing practices. They play an important role in the way that your microbiome is regulated. Obviously also the food you eat has the power to heal or destroy gut bacteria. So, try to avoid added sugars, artificial sweeteners. A lot of this can very negatively influence bacteria in the gut. Refined grains also can be a problem where the microbiome is a little bit overgrown. It's really recommended that half your diet is coming from vegetables because they do contain the kinds of fibers to feed beneficial bacteria in the gut. So, lots of steamed veggies, lots of broth, lots of healthy fats, even some fermented foods, as long as they don't create problems for you. If they do start to create problems for you, then we might have a situation of gut bacteria overload, which is a different problem and solvable in other ways. You'll also want to look at things that create chronic inflammation diet-wise. There's a number of foods that have been found to increase the body's inflammatory response and really should be avoided, probably generally, So I would put them into the too processed and too refined group. So these are foods like white sugar, really cheap vegetable oils that are found in things like mayonnaise or salad dressing, cheap barbecue sauces, and crackers that aren't well made, bread that isn't well made, potato chips, fried foods. A lot of the flour products really can have these adverse effects. It's just not the way it occurs in nature, and so your body can handle it, but it's not the best case scenario. Artificial additives can be a problem. Saturated fats in really high amounts, like taking in a lot of dairy, eating a lot of processed meats, too much like bacon, hot dog, deli meats. Trans fats, these are the things that are usually found in margarine or shortening or baked goods like donuts and cookies and muffins, especially from the bigger box stores. Non-dairy coffee creamers, those sorts of things. Fast food will often be inflammatory to most people. And then alcohol. A drink's okay, but avoid regularly drinking a lot. The key is really consumption in moderation. So naturopathically, when we look at arthritis, we also usually talk about metabolic detoxification. In the Alleviate process, we're really using a clean slate process. So these are things where we're actually incorporating a plan for detoxification, because metabolic detoxification is really providing nutritional support to facilitate the body's totally natural pathways involved in excreting toxins, both the kinds of toxins that are brought in from the outside and the ones that are produced naturally on the inside. And so, as some of you may have already experienced, the metabolic detox steps really include reducing food triggers for the condition, and optimizing gut, liver, and kidney function with phytonutrient-rich foods, usually by performing metabolic typing. That's what I would do in clinic to individualize the diet. You can also support your liver function with the medical foods that we use to just basically supply all your needed detox factors, and it just lets the liver clean itself out. So at Residence, we're usually using Ultra Inflamex or Ultra Clear Plus for this. We can use clean eating to lessen the burden of incoming toxins. We encourage healthy eliminations through stool, urine, and sweat, and also, balancing hormonal metabolism. That just decreases the impact of stress or hormone imbalance, which can aggravate arthritic symptoms. They're not obviously the cause of it, but they will aggravate it. The other thing that can be useful from a clean slate process perspective is to try an elimination diet. So those are short-term eating plans to eliminate foods that cause digestive reactions. So we base them usually on IgG testing. That's a blood test to evaluate how reactive you are to certain food antigens. And then following the elimination period, which is usually about 4 weeks, foods that test as intolerances are reintroduced one at a time. And what that lets you do is determine which one might be related to exacerbations in joint pain or other symptomatology. And I've had definitely cases over the years where the symptomatology was drastically affected by foods. I can just remember one patient, early on in my practice, almost 20 years ago, who had quite severe rheumatoid arthritis to the point where the joints really were very damaged and there was a lot of bone resorption, so the fingers were actually shrinking. And she wasn't very old, maybe late 30s, early 40s. And it really was exacerbated by dairy products. She had done an avoidance strategy, like a fasting strategy, and when she put dairy in, it was just unbelievable. But she didn't want to inconvenience her family, and so I remember she started eating it anyways, even though it created such incredible pain. But it can be amazing, like the pre and post difference. So not all arthritis has food intolerances directly responsible, but intolerance information, you can always take that into account, like in your metabolic typing plan, or if intolerance is contributing. The benefit is that you're significantly decreasing the amount of immune-related stress, and that typically reduces inflammation. So in some people, the elimination of intolerance foods clearly have a major impact on symptom control. So supplements can also be useful for returning gut microbiomes to normal and reducing pain and dysfunction associated with arthritis conditions. And here we're talking about some missing ingredients that might be a little bit more problem specific. So as an example, in osteoarthritis, there's a common use of glucosamine or chondroitin sulfate, and they're basically subunits of cartilage. So studies report a lot of positive results for glucosamine supplementation and reducing pain. It can certainly slow cartilage loss. It's not completely going to reverse it because, again, this is an inflammatory condition, not just the fact that you're losing cartilage. So, and a lot of the effect for glucosamine and chondroitin actually requires proper hydration. So if this works, they work. And if water isn't there, and you try and use glucosamine, a lot of time it won't work. So if these kinds of agents also don't work, so if you've tried glucosamine in the past and you haven't had much effect from it, either, like I said, you're dehydrated or you don't actually have osteoarthritis, because it's fairly reliable that you get some relief with that. So in pain management for arthritis, you can often use SAMe or S-adenosylmethionine. It's basically a naturally occurring chemical studied for its effects on pain management. And studies even show that SAMe might be as effective in arthritis treatment as NSAIDs. Omega-3 fatty acids can have a very nice effect. So things like fish oils that can help calm all sorts of arthritis, including rheumatoid arthritis and lupus and the other ones that are more markedly autoimmune, anti-inflammatory or inflammatory. In the office, we actually use a number of different types of fatty acids, but the ones most useful here are usually SPM active and super EFA. You can also try using MSM, that stands for methylsulfonylmethane. That is a compound naturally found in fruits and vegetables, and it's really thought to help form connective tissue in the body and possibly reduce arthritic pain. It's very useful for people with fibromyalgia a lot of the time. There's also vitamin C and the associated bioflavonoids, because basically what those compounds do is they improve the building of connective tissue, and the combo of vitamin C and bioflavonoids can really help to stabilize a cartilage matrix damage, and that can be in all kinds of arthritic joint pains. Also, proteolytic enzymes have been found to have a very nice anti-inflammatory effect when taken in between meals. So at Resonance, we use WOB enzyme N, and so that's kind of a high-dose enzyme that's specifically for arthritis, and it can be used for any type of arthritic pain as well as injury. Now, we can also talk a little bit about potential herbal therapies. The top herbal mixes that I find useful in clinic include like inflavamide and curcuminoid complex and certain tinctures that are both nervous system and immune system regulating. And some of the things that are commonly found as foods, like here, of course, we see ginger. And ginger roots are really known to improve joint function and reduce inflammation for both osteoarthritis and rheumatoid arthritis. Turmeric, which most people have heard of, so that has a lot of anti-arthritic effects. I find personally, you can eat turmeric and it'll have a mild effect, but we actually have a form of it in inflavamide and curcuminoid complex that are pretty concentrated, and they work really well. You can use frankincense oil directly, topically on painful joints to help reduce inflammation. You could use comfrey root topically again. You can make clearance, like herbs that have an impact on joint pain by improving clearance, like burdock root or nettles. Licorice root can also help a lot. It also supports your adrenal gland, which often has an impact on inflammation. There are a lot of natural therapies that you could do. Again, in office, we've used neural therapies, just surface injection technique, especially if people are really having difficulty with an osteoarthritis and even a rheumatoid arthritis. It can really help just move things in and around the joint. Also, sound therapy can be great. We do a couple of different kinds of sound therapy, and that can actually improve symptoms quite a bit. Visiting your local acupuncturist can be a great idea. They really do specialize at moving fluids around a joint. You can try hot and cold contrast. That can often help pain and stiffness of arthritis, and that's like hot 3 minutes, cold 30 seconds, 3 times, ending on cold. Massage is useful as long as the joints aren't in too much inflammatory pain. It can really help move things around. And mind body therapies, we already talked about this a little bit. It's really important that you spend a lot of time identifying your stressors and hopefully mitigating them somewhat. So I hope that gives you some ideas. Arthritis is really a complex set of conditions, but it can be helped in a lot of different ways. And so as long as you kind of have a ballpark of what to try, I think you can make a pretty good dent in pains. So, and as I've said before, every time you show up to one of these events, you make another step of self-empowerment in your own health. And I'm super proud of everybody that I know that has a chance to come onto the call. So here are the next events in this series, and you can register in advance online at whole-life-medicine.com, which is our resource site for Resonance. Our next event is Increase Your Energy Naturally, which is in December. Although please note the date is not the last Tuesday of the month, as it is for typically other lectures. Our January lecture will also be a little early because we're going to talk about metabolic reset in time for New Year's resolutions to unfold. And don't forget about the Kid and Family series. And the next one is Holistic Newborn Care. So for the more curious community members or those who have aligned with an established health journey, we're going to be holding live events several times per year in the Align series. And during these events, we're going to have more time together to learn and experiment and practice, all in person while deepening our understanding of health. So I hope you'll be able to attend one of those coming up in the new year. So I really appreciate you all for taking the time to experience this webinar today. And of course, if you have any further questions, please post them for us on Facebook. I am always here to support you, as is my staff. And so I hope to see you at our next webinar in less than a month's time on getting your stress organized. All right, take care, guys, and I will talk to you really soon.
Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you will join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.